So if you're one of the millions of people that are dealing with migraines on a chronic basis, you're probably willing to do anything to feel better. And we talked about all the different medication options that are available to you in our last video, but if you go online and you search migraine treatment, you're going to see a whole bunch of different alternative methods that come up as well. It's difficult to know if any of these other options that pop up on your search feed are valid or not valid, so that's what we're going to talk about today, all the different alternative treatment methods for migraine. And first we're going to discuss neuromodulation devices. These are relatively new on the market. They've been studied and approved by the FDA, so there's a lot of research behind them. And these are devices that either deliver a small magnetic pulse like the STMS or small electrical currents such as gamma core or cephaly. Cephaly is used daily for 20 minutes on the forehead. Gamma core is used to stimulate the muscles around the vagus nerve. Each of these devices have been shown to reduce migraine headache frequency and pain by approximately 50%. And these are indicated especially if you're one of those people that don't tolerate any of the medication options that are available to you. I have not had any patients try these yet, so I have no personal experience to share with you on any of these, but there's a lot of good research behind them, and it's definitely something worth trying, especially if you are a chronic migraine sufferer. Something else that a lot of my patients have tried actually is acupuncture. If you're not familiar with acupuncture, it's using small needles along specific pathways in the body called meridians. Acupuncture is ancient Eastern medicine, and there's not a lot of scientific research behind it on how specifically it works. However, I've had many patients that have come back after an acupuncture treatment and reported a lot of success with headache reduction. I've also had patients that have tried it without much luck, so it's kind of a case-by-case basis, and I would definitely recommend finding an acupuncturist that is familiar in working with people with migraine disorder. So it's definitely something worth checking out to see if it's right for you. There's also an option out there called daith piercing. This goes along the lines of acupuncture in the sense that it uses an acupressure point in the ear. There's a piece of cartilage where the outer ear and inner ear kind of come together right above the ear canal. And if it's pierced right at that particular spot, it is believed to trigger that acupressure point, and you can play with the earring in that location and kind of twist it and move it around to stimulate the acupressure point to decrease your headache frequency. I have had a patient in the past that has tried this technique and they loved it. The cons for this technique is that there's a high rate of infection with a piercing in this area. If you're someone who likes to change earrings frequently, it's kind of an awkward place and difficult to change the earring, so it might not be right for you. And a lot of people say that it's painful to get piercing there because it's through the cartilage. So that's out there as well. Another option that is more mainstream also and becoming more mainstream is yoga and meditation. Now, yoga and meditation is not going to prevent chemical changes in your brain and hormone changes in the brain that trigger a migraine. However, yoga and meditation will help decrease your heart rate, decrease stress, decrease anxiety, and as we've discussed before, these are all migraine triggers. So if you can help keep your triggers under control, the thought is that you will help control the frequency and intensity of your migraines. In addition to a calming effect, yoga especially can help with increasing your posture and stability. Different poses such as child's pose and bridge pose will help increase neck and core stability, and this will in turn help your posture. We'll talk later on about how that's important with migraine management, only because it helps manage those secondary headaches that come around. There's also behavioral treatment such as biofeedback and progressive muscle relaxation. The goal with these techniques is to decrease physical and mental tension. Research on these has shown that it's 45 to 60% effective in headache reduction. However, these studies were not specific to migraine themselves. So if you do have migraines, and especially if you deal with other migraines on top of them, particularly tension type headaches and cervicogenic headaches, then biofeedback and muscle relaxation techniques might be extremely effective for you. There's also a specific nerve block out there called a sphenopalatine ganglion block. And this is a bundle of nerves that sits right behind the nose. And a physician would use a guided x-ray technique to inject that bundle of nerves. And it's linked to the trigeminal nerve right behind the nose. And the trigeminal nerve, as we've talked about, relays pain signals from the head and face. And they inject kind of a numbing medication into that bundle of nerves. It has shown to be up to 86% effective in treatment of migraine and cluster headaches and can last for several months at a time. Again, you would need to find a physician that is very familiar with this technique, but research looks really positive on this one also. A lot of people are starting to use essential oils also. Peppermint oil and lavender oil are the two that are most commonly used for headaches. Again, this is not specific to migraines and there's not a lot of research on it. However, again, these scents in particular are very calming and soothing, and if it can help decrease stress and anxiety, then it might help decrease some of your migraine triggers as well. It might not be as effective once you're in the middle of a migraine. And the final alternative treatment that a lot of my patients have tried is chiropractic care. Chiropractic care can be effective also in managing secondary headaches, helping with posture and body alignment that can contribute to extra migraine pain and symptoms that come along. So feel free to get in touch with me to ask more questions about these different treatment options that are out there. Next time, we're going to talk about how physical therapy is effective for migraine management. Until then, if you have any questions, like I said, feel free to get in touch. We'll see you next time. Bye.